for the last panel about neurotechnology in defense, I want to invite Asaf Harel. Asaf Harel is a Ph.D. In neurotechnology and is the lead and CTO at MAFAT.
Okay. So hi everyone. Thank you for staying. It's really not trivial. Yeah, you can come up. Rani, Ziv, you can come up. So being the last panel, I'd like to say they saved the best for last. I'm not sure that's true though. My name is Asaf Harel. I did my PhD in computational neuroscience a few years ago, focusing on brain-computer interfaces. And for the last 2 years or so, I've been working in MAFAT with really amazing colleagues to advance the neurotech sector and how it relates to defense. So I think the word neurotech is a bit new, and that's not a pun. But so just to preface with a bit of a terminology. So when we say neurotechnology, we mean any type of sensors or technology that integrates with the human nervous system. So that means you could either read or write information to the brain or from the periphery nervous system, and use that information in a way which is informative or benefits the person who's using the device. And anyone who's been reading the news a bit lately, you've probably heard of Neuralink by Elon Musk and other such companies which use really invasive technology to read and write to and from the brain, which is incredible. At MAFAT, we're looking at non-invasive technology, so I hope that everybody can sigh a relief. So that's the what. So let's talk about the why. Why do we need neurotechnology for healthy populations? So you can think about different types of training or individualized training and vetting. How do you find the person who's most suitable for a specific job or operation? And that's on the healthy spectrum, but you can also think about rehabilitation and PTSD. And these are unfortunately problems that we're experiencing in huge numbers in Israel right now. I'm sure you guys know this. So that's the why. And the last thing I want to talk about is the why now. So maybe you guys heard about this. Morgan Stanley just issued a report that the BCI market in the US for 2035 is expected to be around $400 billion. And that's just for the clinical population and in the US. So it's a huge market in terms of resources, but there's obviously other offshoots or other relevant use cases which are outside of the clinical populations, and this is what we came to talk about. And last thing, there's, I would say, 3 layers of innovation which have brought us to this point. One is sensors. We're seeing better sensors, smaller sensors, which can measure differences in brain activity and gain really granular insights about what's happening in your nervous system right now. The second layer is, and I can't escape saying this, it's AI, or the different algorithms for machine learning, which can classify your intent, your emotional states, your cognitive capacity, and translate that into some third layer, which is the application layer or the use case. So that's why now, and we have a great panel here to talk about all of these layers. We have, I'll just go on this order. We have Yair Levy, CEO of Brain.Space, Rani Cohen, Executive Chairman of Gray Matters, Yoel Langer, CTO of Wearable Devices, which, by the way, makes a wearable device, which is great. and Ziv Peremen, Dr. Ziv Peremen, CEO of X-Trodes. And maybe I'll just give you guys each a minute to introduce yourselves.
So I'll do it first. Thank you, Asaf. Brain.Space is a deep tech company. We're actually collecting data from the body and the brain in order to use this data to develop mental models that can quantify and tokenize the mental state of users. We provide those models to our partners and customers in order to allow them to really understand the state the users are in when they're using the product, designing the product, or the solution they provide to them. And by doing that, they can really understand and customize the design and the product to fit the mental state of the user and to make it a more user-centric solution, which makes it much more enhanced and actually improve the performance of the user.
Hello, Leeor, from Wearable Devices. So we developed this Mudra band here. This is an example of a neural interface. We use it to control next-generation devices, such as the smartwatches, extended reality, and any situation where you want touchless technology. So touchless interfaces with neural tech.
Thank you all. Thank you, Asaf, MAFAT, and all the audience here. I'm Ziv, the CEO of X-Trodes. We develop a unique skin patch. It's a small sticker that we can attach to our skin and measure the physiology signal of our body. Our body generates electricity, and it doesn't matter whether it's our heart, our muscle, and the brain. So we developed this small patch that gives us the ability to measure all this information, but not only in a lab like it used to be for many years, but take it outside to the homes and to extreme environment. So we started in the field of medical, focused on sleep and cardio, and recently we expanded to other fields, measuring pilots, measuring race drivers, and many other applications. So the basic concept of neural interface and the ability to measure our body signals in any environment, this is the focus of what we do at X-Trodes.
Hi, Rani Cohen. I'm founder and executive chairman of Gray Matters Health. We commercialized the technology that was developed in Tel Aviv University and Ichilov Hospital, mostly invented by Professor Talma Handler. What she did was to fuse fMRI technology with EEG in order to produce biomarkers that we can use in treating people with mental disorders. Just a couple of months before the October 7, we got FDA clearance to treat PTSD with really excellent results. And we are now in many hospitals in Israel already treating people. We are all over the world. We have a lot of clinics now using the technology in the US, 6 hospitals in Germany. As much as it sounds interesting, Israelis, Jews treating Germans with PTSD, but really the top hospitals over there with an EU grant that they gave us. The EU also invested in the company. So we're all over the world now and treating PTSD. On the way is a clinical trial for depression.
So we have, I'd say, companies more in the hardware space, in the application space for healthy and clinical populations. So now's your time to maybe think about future trends. What would you say is the most promising trend or technology in neurotech and development, and some potential applications for both civilian and defense sectors? Yair.
Okay, I think that the main trend, and you touch base that at your opening, is generative AI. Technology is now speeding up, and we human a little bit lagging behind. And may I say that technology sometimes does not understand the language of people, and discarded the LLMs that are trying to mimic our language. There is another language which we are still missing, the language of the body and language of the mind. And I think that the trend that you see here are companies that are trying to learn the machine a new language of our emotions, of our mental states, and the cognitive limitations that we have from time to time. And this barrier that we are going to cross soon, thanks to those amazing companies that's providing good technology that can allow the machine to better understand the person that uses it, and to actually bridge the gap between the human, the blurred human, and the machine, which is logic, and provide the machine a language that she can really understand with the right granularity to enhance the person to use this. And this is going to be the next frog leap of Gen AI.
So just a
Sure.
small point. Through the conference, we've been talking about this amazing new technology, autonomous systems, but all these systems are really interfacing with legacy hardware, which is our brains. So this is thousands of years old hardware. So how is that interaction working out? How's that happening, that interface?
So the point here is to look at it at a twofold vision. One, we need to train this baby, the AI, the new language. In that perspective, use as much information you can use. Go for the body, GSR, EKG, all kind of sensors that are surrounding our body, and of course, go to the source. Get the knowledge from the electricity, from the magnetic resonance of your brain, and then train the models to understand the new language that the machine needs to learn. And then go to implementation using what we used to call reduced models. This is actually a rational design of the need of the use case. So if we're talking about the pilot is now training a simulator, he will probably need a certain sensing devices, several sensing devices, not a complete full set, that will advise the machine what is his cognitive load. On the other hand, if you're talking about a driver that is now very tired because it was stayed in a conference too long, you will probably be sufficient with the camera in the car and maybe another sensors on the wheel. And that will allow the translation of the language that we trained using a lot of sensors into the ecological environment that you have in the use case. Sure.
I definitely agree with what you say about natural language. I think it's missing from the world of the digital communication world of today. I will say about an exciting thing that's happening today right now is the extended reality being developed in reality and Meta reality labs and in Israel in Yokneam in wearable devices. And in this sense, it's not a monitoring solution that you will go in depth on, but a control scheme. So what you can do with neural tech is sense the amount of pressure between the fingertips, for example, and applied pressure, and then use that to interface, such as to drag and drop, move items in touchless devices. So this is where the magic happens, at least the most simplistic magic, where you only understand the most basic element of communication, which is sort of moving things around or interacting with an interface.
So you imagine some world where the training capacity for a person to operate a drone or a helicopter or a plane is much more intuitive. So you're just doing whatever you think needs to happen, and it just happens.
Yeah, I think that we will be virtual buttons, not physical ones that we hold today on a controller, will be something that is accessible in the near future, yes.
Okay.
I will continue the discussion about this trend of controlling the external environment. But I do think that we see trends of controlling the environment either with virtual buttons, but also with silent speech, like speaking without anybody, and with mind, just thoughts. So we do see a lot of technologies, and it's early stage, but we do see it, that decoding our patterns, our physiology patterns, and it doesn't matter it's our muscle activity or the muscle of speech muscles or thoughts and the brain activity, and decode it into patterns that we can understand and control the environment. So I think this is a trend that we can see. It's still early trend, but super interesting. On top of this trend, I will mention additional 2 trends. One trend of moving or shifting all this technology of neuroscience outside the labs and clinic. Why it's such a huge thing? Because neuroscience is hard. It's noisy, and it's really, really hard to understand what is going on inside our black box. And today, or we used to measure it only, we started in Faraday cage in order to have to eliminate any noise that could affect the signals. Then we moved to a silent area or isolated rooms in clinics and labs. And now the trend is to take it outside to the real world. And this is a huge trend and huge challenge for all of our technologies. And I think the last point that I would mention is it doesn't matter whether it's brain-computer interface or human-machine interface. The concept, how we become part of a system. And it could be either to control, like what we mentioned before, or how the system could actually understand our intention or need in a better way, how we can change the system and the environment in order to improve our performance. And all this ecosystem of men and systems, and together how we can improve the outcome, I think it's a huge trend that we are, all of us, really excited of what is going on outside nowadays.
I think that maybe the most important, exciting technology doesn't exist yet. And these guys are starting to develop it, which is the sensors. We need the sensors to be with us always. And then what exists now is machine learning, that once you have the knowledge, you can do a lot of things with it. So anybody knows here what is amygdala hijack?
I think it's called Facebook. Amygdala hijack.
And probably half of the people here have amygdala hijack right now. It's, the amygdala is the center of fight and flight. But for 2 billion years, it was developed in order to fight or flight, not to use our brain to think, hey, this snake, I can pet him because he's brown or so. The amygdala is the center of stress, and all of us are stressed now like we've never been before. So when the amygdala goes up, it cuts the blood with oxygen to our brain. And this is what happens to a lot of us when we argue and so on. And this is something that we need with smart sensors in real time to identify and let us know, take it down. This is what we do today with patients, but we need EEG stations, and it needs to be in a clinic and so on. To bring it to real life, that's the challenge.
Yeah, yeah. So EEG is I think 120 years old. It's really, really old technology, but only lately we've seen it being miniaturized on the one hand, using dry sensors, so you don't need a gel or any type of conducting material, thank you. And it's becoming wireless and small, and I think that's exactly where we're going. Okay, so the next question is, what are some key challenges and opportunities specifically with commercialization? So think about regulations, or public perception. Won't the public be fearful that we're reading their minds?
So I think that the number one challenge that we face in Ziv touch-based that, well, actually, X-Trodes doing great job in that, is actual sensors. None of us used to walk 100 years ago. None of us used to go out and walk on a daily basis with sensor on top of the body. And as I said before, the approach we believe is that we need sensors in order to collect the data and train the models, but we definitely know that the next step will be to reduce the interaction with sensors and the need to be dependent on actually something that need to be attached, definitely on the head. And I think that that's the main challenge, how to speed up the training of the language, of the new language, of the mental language, in order to be able to move forward to the next step and to implement that into the daily wearable devices like the Mudra or like the sticks from X-Trodes or any other technology, new technology that will emerge. And again, the need brings new technologies. When you have a solution for understanding the language, new startups will come up with new technology that will do magic in sensing hardware, or even anything else which is not including hardware that will be able to translate the letters into the language that we have created. So I think that's challenge number one. Challenge number two that you mentioned about, let's say, ethics. I think that as any new technology, there is a fear and there is a reward. I think that Rani just mentioned the magic that they're doing with patients and PTSD and mental illnesses. I think the reward here is 10 times the fear from privacy or from any other ethical elements. And I think that rewards like that will move forward, of course, until the tech giant from Silicon Valley will take that to do a commercialization of Chinese stuff. But
on this point, both Meta and Apple have patents for EEG.
Sensors, for EEG
yeah,
sensors.
so it's coming. Yeah.
Everybody is striving to hold the language, and I think that we see now Anthropic, OpenAI, Llama, and other companies that they put forward a lot of efforts build the large language models. I think that the new language is just on the edge, and I think that here the barriers are a bit higher, and the technology that you see here is the new frontier of the new Gen AI.
I'll say a few words in the theme of what you spoke of. I think that even Google or the big, tech giants had issues with wearables or with putting sensors on your body. So watches are a huge success, but with the glasses, there was a challenge of social acceptability. So the first people that put glasses on were called glass holes, and they weren't accepted very well. And that is a challenge. It's a challenge for putting sensors on our body, maybe, but it's something fundamentally that people are afraid of. And they, of course, we're all afraid of invasive technology, obviously. So it's a balance. How do you make it, in a way that's appealing? That's one. And I think the second thing that Ziv spoke about is the difficulty and in nailing the performance and having highly performant, device that does what it needs to do and is accurate across different people. So it's reliable. It's something that we count on, like a mouse or any other device that we incorporate into our lives.
Just to touch upon one point, in the audience, I have a question for you guys. Please raise your hand if you would approve for an implant to be in your brain. If it provided you with some incredible connectivity to the internet and robotics and such things. Raise your hand. Don't be shy. Okay. Yeah. So the social acceptance is a very big problem.
Yes. Yes.
Not enough data.
Go ahead.
let me continue your question. And would you agree that someone will read your minds on continuous way, non-invasively? Is it something that you agree? And I think that one of the challenges when we'll talk about medical later on, but when we talk on consumer and defense, you have the issue of privacy and fear. Because today, we are still at the beginning of decoding the brain. But basically, if you measure the brain signals, potentially, you can decode everything. You can decode your thoughts, your memories, emotions. And there is a real fear here. And there are some countries that actually use EEG only as a medical, and they don't allow you to either to use this system or to collect it and to use it for other uses. In my point of view, it's something that we can deal with it. We deal with many other privacy information that we have in our phone and other devices, but it's a real challenge. And this privacy of our own black box is a challenge. In the field of medical, I think the additional challenges that we have is we have a high bar of regulation. And Rani knows they had a long process with the FDA to get the approval, but we know that it's a high bar to get this approval in order to use these tools, and it's very focused for specific indication, which limited the ability to use it on a scale.
So once you have a commercial product that looks in your brain, you need to have a lot of regulation in order to approve it, because it can really change things in your brain. I'm trying to now to differentiate between the defense part of it, which you have soldiers that are getting PTSD or are in big stress, and how you can help them. But even in the army, they are being treated with psychiatrists, and the same is with us. We need to go and sell it to psychiatrists. Now, the biggest commercial issue that we are facing is that psychiatrists don't have any technology, right? You know, most of them, they're buying sofas in IKEA. That's the highest end technology that they have. So now we're dealing with the early innovators, and we need to, and we're seeing an amazing response, because there is not a lot of treatments for post-trauma, but we are dealing with the early innovators. And it's going to be, from a commercial point of view, interesting how we move to the next step, how to convince the people that are in charge of our mental health that what we are doing is really something that is controllable and can contribute to mankind.
I would like to add another challenge, which is actually on the opposite side of what you've mentioned. I think that another challenge that we have is that we are considered sci-fi. In many cases, people do not believe that we can do what we do. And lucky for us, we have some marketing, but this is a big challenge of showing that we do real work here that can really happen and really change the future of humanity for the best.
Yeah. So one final question. And by the way, Rani, you gave me an idea for a startup. Maybe we can integrate EEG sensors into IKEA sofas. Then it's the best of both worlds. The IP is right now. Okay, so the last question, and this is a defense tech summit. So how do you see neurotech being used for defense purposes?
Should I start? Okay. So I see three fundamental use cases. First and most, knowing the mental states of a person and soldier that is now in a harsh condition, under stress, after a lot of hours of not sleeping and multitasking with many information that's streamlined to his eyes, ears, well, activating a lot of sensing activity. You would like to know his condition and to avoid mistakes, and unfortunately sometimes critical, severe actions, and you would like to increase the safety based on prediction of his mental and cognitive states. Second, of course, to implement models that can understand the state of this person and to adapt the system accordingly. So one person is fresh, is came after the good sleep, and is now focused and ready for the task. Bring it on. Give me the information, give me the task. I can do so. The other person is tired. He hasn't seen home for 3 weeks. Now it's time to delegate the task, or maybe to adapt the streamlined information, provide him only the most critical piece of information. And last but not least, and I'm talking about mental states, of course, if we have patients already with PTSD, luckily we have Rani and his gray matters to improve that, but using predictive models, we can actually mitigate those conditions in advance and reduce the severity and reduce actually the amount of patients that Rani will have. Sorry, Rani, for jeopardizing your business, but I think that it's for good.
So yeah, from the sci-fi aspect and from the sort of the defense perspective, I see a possibility of making an interface that sort of overcomes the hurdles of some of the clunky equipment that you can find in the military. Again, this is by itself a challenge and needs to be thought of carefully in which situations and how, and that's sort of what we're doing here.
Are you suggesting that the military is clunky?
Some of the equipment that I used to carry around, that was a long time ago, though, was a bit clunky. And there's better ways to do that, I'm absolutely sure. No.
Medical, I think we can keep the safety of the soldier either in all kind of disorders or states like fatigue or stress. In the field of performance, we can add this technology in order to improve performance and make sure that we improve the results of our soldiers, and controlling the systems.
If we had a neural interface, you could just, turn it off.
I think that we can improve the efficiency of using our system, reduce the latency of use it, control large mechanism or large system with either silent speech or thoughts or gestures. And I think we can improve dramatically our interface with the system around our soldiers.
So we had a paper on the cover of Nature Human Behavior with 180 soldiers, and we showed how if they learn how to control their amygdala biomarker, they can reduce their stress during very stressful period. So as I told you before about the amygdala hijack, when you reduce your stress, you have more of your brain, and you can do better whatever you do, whether you're a pilot or in Golani or whatever. So that's something that we believe that at the end every soldier should be able to master, and we tend to believe that it will also decrease the amount of PTSD later on, but for this we don't have any proof yet.
Okay, thank you very much. And lastly, I just want to end with a short call to action. So this is a new field, neurotechnology. And anyone who's has some value proposition or a company or is interested in the space, please feel free to contact me through MAFAT. And thank you very much to the organizers, both for the conference and for inviting us. And have a good evening.